Om Swastiastu. We are from SGD B8, and today our group will be giving a presentation on obesity in teenager. My name is Darren, and I will start with chapter 1. So the background. Obesity is a significant public health problem which is a result from the combination of genetic, behavioral, and also environmental factors. And the incidence rates of obesity has also been found to rise steadily over the years. Adolescent is a population that should be considered especially since obesity during this phase is associated with future comorbidities such as type 2 diabetes, hypertension, dyslipidemia, and even non-alcoholic fatty liver disease. In addition, obese adolescents could also experience psychiatric disorders such as depression, poor self-esteem, anxiety, and many more. Since obesity in adolescents is a multifactorial disease and could lead to various complications, interventions focusing not only on pharmacological therapies but on intricate interrelated approaches from the aspects of family medicine are highly needed. So the problem formulation here is what is the definition of obesity in adolescents? How is the epidemiology of obesity in adolescents? What is the etiology of obesity in adolescents? How is the pathophysiology of obesity in adolescents? What are the examinations needed for obesity in adolescents? What are the risk factors for obesity in adolescents? How are family interactions in cases of obesity in adolescents? And how does obesity in adolescents affect families? The purposes have been in accordance to the problem formulation. And lastly, the benefit is to give comprehensive information regarding obesity in adolescents, which could benefit both societies and medical practitioners. And the second one is to discuss obesity in adolescents from the perspectives of family medicine. That's all from me. Thank you.
Okay, Om Swastiastu, greeting to evaluator and facilitator. My name is Evangelina Vincent Utamila Serda with last 3 digits student ID number 170. On this occasion, I will continue explain about the chapter 2, the definition of obese in teenager. Obesity is defined as an abnormal accumulation of fat in the body adipose tissue which poses health hazard. Obesity in adolescents or teenagers start from 2 to 19 years old is expressed by BMI Z-score or percentile that vary by age and gender. Obesity in teenagers, according to percentile, is defined as a BMI more than 95 percentiles. Meanwhile, extreme obese are at over 120 of the sex-specific 95 percentile for their age. Well, that's all from the definition. The next point will be explained further by my friend, and thank you.
Hello everyone, my name is Krisanta Aldramintrarjo with the student number of 20025111230. And now I'm going to explain about the epidemiology of obesity in teenagers. The issue of obesity among children and teenagers is a notable public health concern in both developing and developed countries. In 2016, over 340 million children and teenagers aged 5 to 19 were classified as overweight or obese on a global scale. And estimates from the 2018 National Basic Health Research revealed that in Indonesia, 1 in 5 children aged 5 to 12 and 1 in 7 adolescents aged 13 to 18 are classified as overweight or obese.
Introduce, my name is Dave Christopher Manhutu with last 3 digit of number 107. I'm going to continue the presentation about the etiology of obesity in teenager. Obesity is influenced by internal factors such as genetic and medical condition, and also external factors such as lifestyle and environment. Genetic plays role 40 to 70% approximately of the development of obesity. In both parents that have obese, it will increase 13 times risk of the children have the obese. And also it is affected the habits that consuming large amount of sugar drink and fast food will also can increase the risk of obesity. Association between screen time and obesity is also found. Screen exposure can affect children to increase the exposure of food marketing, increase of minors eating while looking at the screen. It is also growing evidence about the shorter sleep duration, poor sleep quality, and later bedtimes are associated with poor eating habits that can lead to the obesity. Obesity is also result from the medical conditions such as endocrinopathology, which is hypothyroidism, hypercortisolism, and also growth hormone deficiency, which can lead to the obesity. That's all from me. Thank you.
Greetings, my name is Tina Putriyanti with the last digit of student ID number 109, and I will continue the presentation about the pathophysiology. Pathophysiologically, obesity in children and teenagers is caused by a confluence of social and personal factors. Individual eating habits and the propensity to gain weight are influenced by biochemical and physiological factors in addition to one's hereditary risk. It is caused by interference in the mechanism of the balance of body energy and by a higher body mass index in children percentile over 95 on the basis of sex. It was brought on by the accumulation of fat from consuming too much energy from fast food and not habitually breastfeeding as a child. The family, the community, and the availability of socioeconomic research, such as parent and individual education and household income, are examples of societal elements that furthermore these behaviors.
Hello, my name is Dewa Ayufani Parmasanti and the last three digit of my student ID number is 004. So today I would like to explain about the examination of obesity in teenager. The examination of obesity in teenager require a medical professional or by healthcare provider. It often diagnosed through body mass index or BMI, and BMI is a statistical measure that calculates an individual's estimated body fat for both males and female based on their height and their weight. To diagnose obesity in teenagers or children, healthcare providers also use a percentile system to diagnose. The classification for obesity in teenagers are listed as follows. First, BMIs exceeding 30 or the 95 percentile for both gender and age, whichever is lower. If the child's BMI falls into this category, a comprehensive health examination is recommended. BMIs that fall between the 85 and 95 percentile or BMI 30, if that is the lower limit. According to this finding, the kids need to undergo a screening that examines 5 potential health risk areas, namely cardiovascular disease, high cholesterol, diabetes, and obesity in the family history, elevated blood pressure, total amount of cholesterol, and a large annual increase in BMI, including the child personal worries about being overweight. Okay, that's all from me. Thank you.
Hello everyone, my name is Dewa Ayu Bintang Permatasari with the student number of 2002511211. So today I would like to explain about the risk factors of teenagers' obesity. There are several factors that can contribute to the occurrence of obesity in teenagers, such as nutrition and diet, physical activity, socioeconomic status, and also genetics. First, I would like to explain about the nutrition and diet. People who eat at least one fast food restaurant meal a day and drink soft drinks that are carbonated more than twice a day have significantly increased chance of being overweight or obese. Skipping meal in the morning is also being a major risk factor for increased risk of obesity. Next, I would like to explain about the physical activity. Physical activity seen in adolescents at risk of obesity is mostly low, which is at 42.3%. Low physical activity has 3 times the risk of obesity compared to heavy activity. Teenagers are less motivated to do physical activity in the form of sports because they do not master a particular sport or even don't have any time to do that.
Greetings, I'm Daniela Vanessa Kalista with the last 3 digits to the number 140. I'll be continuing about the risk factors of obesity in teenagers. So the next factor is socioeconomic status, which also have a significant effect on obesity, including the low education levels of parents, low socioeconomic backgrounds, non-parental carers, less quality of sleep duration, and less frequent food consumption, and parental obesity as well. The next factor is genetics. So the offspring with inherited genetics from obese parents have a 3.9 times risk of suffering from obesity. Researchers stated that if one of the parents is obese, then the child has a 30 until 40% risk of becoming obese. However, the risk increases to 70 until 80% if the both parents are obese. That's all from me. The next presentation will be continued by my college. Thank you.
Okay, I will continue with 2.7, family interaction. The reciprocal aspect of relationship between adults and its children deserves significant attention as means of impacting the health behavior of both age groups. Family involvement plays a crucial role in the success of efforts to attain and sustain weight loss and preventing obesity. Next. The key interaction that can be assessed in family interaction, the first are family meal pattern. There could be issues such as irregular family meals or frequent consumption of fast food or other unhealthy meal pattern. The other key interaction is parental modeling, in which the issue may be because the parents not modeling healthy eating behavior. The next is physical activity patterns, in which the issue may that the family don't have routinity or don't have a pattern of engagement in physical activities. Next, the next key interaction is emotional support, in which there are no or insufficient emotional support from family members to support its members in preventing and promoting healthy diet and healing or getting out from obesity condition. The next point is communication pattern, in which that there could be a lack of open communication about healthy lifestyle choices. The next is access to healthy foods. There could be also the problem in which the family is not capable of accessing nutritious food at home. The last interaction that should be noticed and assessed is family rules and norms. There could be no discussion of clear rules about food choice and portion size in the family. That's all from me. Next.
Hello, my name is Christian Sinaga with real student ID number is 096. I will continue the presentation with disease impact to the family. So the family medicine approach, there is a compelling evidence that aerobic exercise alone or physical activity causes a small amount of weight loss. But on the other hand, additional data suggests that nutrition counseling works better for weight loss than the physical activity counseling, which is then the physicians could even use collaborative approach by using other healthcare professionals, for example, nutritionists, to give their intervention in order to give their method of treatment. To cure obesity, another several of nutritional approaches are helpful. Meal planning, self-aging, portion control, etc. might be useful to treat this condition. And all of these approaches must include interprofessional collaboration to give the best outcome. Second one is primary prevention. So the goal of primary prevention is to stop an illness before it becomes a threat, using food and exercise as therapies to stop someone who is not obese from becoming obese is an example of primary intervention or prevention. Parents have a unique chance to encourage their people's physical activity and healthy food, including in their child. So it is very useful treatment for prevent the higher incidence of obesity. So using food and exercise as therapies, the secondary is healthy dietary and lifestyle habits should be developed at home through home-based intervention. And the third one is aerobic activity lasting at least 60 minutes a day. And this is what recommends by World Health Organization to prevent the obese incidence. Next.
Hello, my name is Felicia with last digit of student ID number 166, and I will continue the presentation with the secondary prevention. So for the secondary prevention, the most important part is to do the screening. The first one, there is body mass index screening, which an elevated body mass index often related with excess adiposity in the body. BMI more than 25 is considered as overweight, and it means that this person have high risk of obesity. The next one is a count for waist circumference. If the waist circumference is more than 40 inches or more than 101 centimeters in men, or more than 35 inches or more than 89 centimeters in women, it is indicating that this person have high risk of obesity. The next one are visual assessment and skin fold measurement. However, these methods are not very recommended because it is subjective and it will not give an accurate result. Secondary prevention can also be programmed into a type of school-based prevention for teenagers because a lot of teenagers spend a lot of their time in school. And this type of program is usually effective and efficient done from a school. The next one is tertiary prevention. So for the tertiary prevention, the aims is to improve the quality of life by treating the disease. There are 3 types mentioned in this student project. The first one is the pharmacological, which is the first one is orlistat, which is a lipase inhibitor that affects the absorption process of fat and is approved by FDA for obesity treatment for adolescent population. However, there are some side effects for orlistat, which are oily and soft stool, increased defecation, and less absorption of fat-soluble vitamin like A, D, E, and K. Next one is sibutramine,
which is a serotonin and norepinephrine reuptake inhibitor, which will lessen food intake and increase thermogenesis. However, this drug is contraindicated for people with seizure and heart disorder. The next one, there is surgery, which usually done for people who have advanced level of obesity. There are 3 types surgery usually done. There are gastric portioning, gastroplasty, and gastric bypass. And the next one is changing lifestyle, which is also the most important part to prevent or to treat an obesity because it is highly related with lifestyle. So it is recommended for the patient to do diet modification, increase their physical activity, and then do calorie restrictions and do behavior therapy to help them control themselves. That's all from me. Next.
I will continue the presentation regarding the conclusion. Based on this paper, we can conclude several points regarding obesity. Obesity is defined by an abnormal accumulation in body fat adipose tissue. It is a notable public health concern in both developing and developed countries such as Indonesia. The etiology of obesity is based on 2 factors, which are internal and external factors. The example of internal factors such as genetic and medical condition. For the external factors is the example is including environment, social, economic, and lifestyle. The pathophysiology of obesity is due to imbalance between intake and output of energy inside the body. The examination for obesity, which can be examined or diagnosed by using BMI or body mass index. The management of obesity have an important role, which are the family involvement. Uh, from family involvement, it can provide emotional and physical support, especially in the lifestyle in their child. From family medicine aspect, there are several steps which can help through managing of obesity, such as modifying lifestyle of diets, physical activities, and consultation of healthcare provider. Next. So here about our presentation. Thank you for listening.